Well, welcome to my practice inspiration video. My name is Dr. John Caulfield, and I'm here in Littleton, Colorado. And today we're going to be talking about some very important things about Airway is going to be our inspiration today. But really quick, I do work here in Littleton, Colorado in my private practice called Epic Dentistry. I do work with Vivos Therapeutics. I'm a paid lecturer and speak with them. And so some of the content is related to my relationship with Vivos. All right. Well, what we're going to talk about today is that Airway is the answer. Airway starts with A. It's where you want to start. And what I've found is that if you're treating airway, you're really treating all kinds of other issues that we find in dentistry. Sleep, TMD, even decay and periodontal disease are all related to the health of our mouth, which is really related to how do we breathe, how do we sleep, and how do we do things that we do in our everyday functions and everyday life. So here, let's talk about the ABCs of airway and about CPR and sleep. And if you think about it, when we learn CPR, it's about, airway, make an airway, then help the patient breathe, and then circulation. And I've found with sleep, it's really about airway, making sure they can breathe properly. And then again, C for that is where is the constriction? Where is the airway maybe not ideal? Where do they have a constriction or a resistance to airflow? So the ABCs start with A, airway starts with A, and that's what I want to talk about today. We've got to start looking at how important it is to have an airway so that we can breathe, because from the very first breath of life, we grow our brain, our organs, we get our teeth, our jaws developing, our neck, our airway. Everything that happens is with every breath that we take. And the reality is that we breathe about 17,000 breaths a day, which means that you're doing right now the most important thing you're going to do today, which is to breathe. And you're going to breathe so many times that the body is going to respond and grow and be healthy, considering how you're breathing those 17,000 or more times. And what happens is as you breathe and what you do when you breathe is really creating the form and our skeletal growth, our skeletal and jaw development, because form follows function. So, how do you breathe, how you sleep, how you swallow, how you eat, all of this determines the growth and development of the teeth, the jaws, the muscles, the joints, the neck, and yes, of course, your airway. So, airway is really the king when we're talking about any other kind of dental treatment, because if you're not breathing, nothing else really matters. And really, we want to talk about developing and growing an airway, especially in children, because if you don't have a good airway to start, you're never going to have a good airway to finish. So we work a lot with kids. One of the things I love doing with Vivos, we have the guides for children that help properly position their jaws, properly position their tongues, get them breathing through their nose, get them breathing the right way so they can sleep better and be better and really develop their airway so that they have the airway that we see on the right of the screen, which is a good, healthy, big, broad airway, versus the airway we see on the left of the screen, which causes cervical compensation, jaw correction, crowded teeth, all the problems, adenoid and tonsil issues. So we really want to work with kids because this is where we can actually grow and develop and get that optimal start to their airway from the very beginning. And it was through this treatment of airway that I started to see the connection between sleep and TMJ, which are two of the main things I teach and work on in my practice, I should say. And I found out that airway is king. So number one, when I talk about this, is what I kind of came up with is my philosophy, my connection when I'm treating any kind of patient, is we have to have proper breathing. Because like I said, without proper breathing, there's no proper sleeping, there's no proper being. If we're not breathing right, everything else is going to be compensating, and we're going to be going down in a way we're not really getting the full health that we need by breathing every day. And proper breathing means nasal breathing through our nose, unobstructed, unresisted. We have to have the air flow going from the tip of the nose all the way into the lungs. That's going to be using our diaphragm, which is going to be activating our parasympathetic system. It's going to be a vagal response and getting people breathing the right way so that they're feeling the right way and dealing with things the right way. So we're going to talk a lot about proper breathing because that is so critical. Like I said, it is something we do 24 hours a day. every minute of every hour of every day. So breathing really matters, and without it, nothing else really does. So we're also going to talk about proper tongue positioning and function. So if you get proper breathing, now to keep that proper breathing, we've got to keep the tongue up and away from the airway. So having adequate intraoral tongue space, not having that tongue tied down and low, having proper swallowing and chewing functions during the day are so critical. And we can even teach these things through proper myofunctional training. But really, we want to support both the oral health and the overall health, and making sure that we have room in the mouth for the tongue and teeth that are in a good orientation where the tongue can fit and not fall back into the airway. So really critical to understand that when we're breathing right and our tongue's doing what it's supposed to do, we grow and develop our jaws, we grow and develop our airways, and that's going to set us up for long-term success. The third clue and the key that I found in these connections when I'm treating patients for airway sleep and TMJ is that we've got to have that proper jaw position and that proper jaw development from the tongue and from the breathing. We need wider and forward jaws. We need big and broad, big transpalatal width, lots of room for the tongue so that we have lots of room for the airway, lots of room for the joints to go forward and wider. We need proper tongue space. We need proper muscle health and muscle length. It's really important that we understand that where our jaw sits is the health that we get. It's got to be that we've got room for our tongue, our muscles are relaxed and happy, our joints are decompressed, our airway is open so that we can sleep and breathe properly and chew and talk and function on a day-to-day basis the way that we want to. And when all that is done, the fourth and final point, because we are dentists, right? We are the dentites. Now we want to talk about our tooth position. What does our jaw look like? What's our arch form look like? Where are our teeth? How is our terminal bite? Do we have proper guidance to protect the airway, to protect the jaw joints, to protect the muscles, to protect our brain and neurological health? So this is what I've found is if I do these four things really well, I get great outcomes in my cases. And this is what I want to challenge you to look at in your practice and in your cases and in your patients. Is start looking, do I have all four of these pillars to really give us a good, healthy foundation to start from and grow from? So a lot of patients and dentists actually ask me about treating. So I treat sleep. I'm a sleep dentist, and really I don't. I'm not treating sleep. I'm treating airway. And same thing with TMJ. What the research is showing now that TMD and TMJ problems really start from airway protection and from clenching and grinding and from not really having the proper development and growth and not really having the proper jaw position and the proper joint health and position. And so now I look at things a little differently. And so this is where I talked about form and function. And this is where it's key. It's really a balancing act between form and function, whether I'm treating airway, sleep, TMJ, even when we're doing dental function and periodontal disease, right? We got to treat the form and we got to treat the function. And so we really want to optimize our anatomical form. We want to make sure we have the room they need. We have the growth and development of the jaws and the bones and the muscles. And then we also want to get restored back the physiological health of the patient. You know, we have to breathe right. We have to sleep right. These are physiologic things that we need to do if we're going to be healthy and if we're going to be functional, if we're going to make it through our day and feel the way we want to feel and have the energy and have the health that we need to do the things we do, to play the roles that we play. And so this is what I kind of look at now when I'm treating patients is, do I have good form and do I have good function? Because like I said, both are really important and really needed if we're going to get great treatment. So when we're talking about sleep, well, the goal is to actually get a bigger, proper airway, a bigger, better airway, a bigger anatomical form of an airway so they can breathe right through it. And then that proper breathing leads to better health, better mental health, physical health, and more improved airway and usage and function. And so that's how we keep this good cycle going between form and function, where someone breathes better, so then they sleep better. And when they sleep better, it helps them to continue to keep their airway healthy and breathe better, and better breathing again leads to better sleeping. So we get what we call the nutritious cycle versus the vicious cycle of not breathing well, not sleeping well, not feeling well, gaining weight, having hormone issues, thyroid issues, then going into more improper breathing, improper sleeping. And that just kind of continues for these patients, whether young or old. And so we've got to break that cycle and restore a good, healthy form and function cycle to get them back to where they really want to go and need to go. So for me, it was about getting back to the basics. There are so many good books that are out there now about this. The book Breath by James Nestor, The Breathing Cure by Patrick McEwen. There's so many great resources that patients are reading about. And I think more of the airway dentists I'm talking to are reading about as well. And we're learning more about how important it is to breathe properly and breathe correctly, and how really that is the primary foundation of health for our dental health. And so noses are for breathing. They have a critical function to warm, humidify, sterilize the air, to make sure that the lungs are functioning better, to make sure we're getting good oxygen and carbon dioxide movement and respiration is happening correctly, get nitric oxide. And mouths are for eating. We need mouths to really be there for chewing and functioning and eating. But if we don't breathe through our nose, we breathe through our mouth, we have all these things that changes the shape of our face, the development of our muscles in our jaw. It causes dehydration in the mouth, bad breath, acidification, even dental and gum disease both can be caused by mouth breathing. So we've got to start looking at the basics. The nose breathing has so many activities that are so important for us, whether it's parasympathetic, diaphragmatic, breathing like we talked about, nitric oxide. And really what I've found too is that we have to balance out the CO2 and O2 levels in the blood and in the brain, because in the brain, the CO2 level is what tells our body to breathe. And so it's very critical to not overbreathe or underbreathe and keep ourselves from getting into hypercapnia or hypocapnia. We've really got to get to where the oxygen and the carbon dioxide levels are balancing each other out, and we're getting optimal breathing, therefore optimal sleeping. And when we breathe through our mouth, we put our body into a fight or flight mode. We use our chest muscles. We actually can create more snoring, more sleep apnea. Again, the mouth environment is not good to be acidified and having dirty, cold air breathe into our mouth. We want to go through our nose to filter that air. And when we do all this stuff, it changes our nitric oxide production and release. And it also changes the shape of our face and our jaws and the development of our joints. So huge implications for just getting back to these basics of breathing through our nose those 17,000 times a day versus breathing through our mouths all that time. So once you can look at that breathing, now we want to talk about how do we get a good, healthy airway. And number one, again, is restore the form and the function. But here we're talking about the nose, the nasal form and function. And this is where I use my relationships with several ENTs in the area. They're going to be looking at, does the nose form look right? Are there deviations in the septum? Are there septal spurs? Do they have inflammation and congestion in their nasal passageways? Is there tonsils and adenoids in the airway? They're going to look at that form and see what we need to do. And then once they change that form, whether it be through surgical or non-surgical approaches, once we get that form corrected, now we got to make sure that we're all focusing on improving the function, getting that nasal breathing working once we establish that nasal airway. So nasal hygiene is important. We all talk about oral hygiene before bed, brushing, flossing, and so forth. But the nasal hygiene is also critical so that somebody can go to sleep and they can breathe through their nose all night long. And so, using proper rinses and irrigation, practicing nose breathing and doing some exercises to really get the nose functioning well and breathing well before they go to sleep has been a huge help for most of my patients, because it does get them breathing the right way, starting to balance out that CO2 and nitric oxide to open the airway more, to help them sleep better and breathe better. The reality is the front of the airway is the nose and the maxilla and the tongue and the jaw. And then we've got to get all those things in a good places and all the tissues that are associated with those to have a good airway, to have a chance at a good airway. So that's what the dentist can do, what the ENT can do. And then the other thing is we can pull the lower jaw and tongue forward to open up the airway from the anterior posterior dimension. And that's what we've been doing for years, right? And we're going to talk about that in a second here, but making sure we can advance the mandible. And really, we're not even advancing the mandible, we're advancing the tongue that's tied to the mandible. So we're keeping the jaw and the tongue forward, keeping those airway tissues and those tongue tissues in the right place, keeping the airway space, keeping someone breathing healthy through their airway all night without obstructing, without snoring, but sleeping and restoring their health. Now let's talk a little bit briefly about the back of the airway, because this is one of the things that's been a huge difference maker in my practice. And the back of the airway, which is about a third of it, is made up of the cervical bones and all the cervical tissues and muscles and ligaments that hold the neck together. And so if you can correct the alignment of those neck muscles, you can actually correct the lateral and posterior aspect of the airway. And so I'm going to just show you guys here a couple of slides of my patients. And if you look at these slides, you're going to see that the neck bone is rotated in reference to the green line. And wherever that neck is rotated forward, the airway collapses on that side. And so the distortion of the neck distorts the function and form of the airway. And so I've seen this over and over again. Here you see that the atlas bone, and actually this one's C2, is pushed more forward on the patient's right side, and it compresses the right side of the airway in the patient. And if we go down to the next bone, you'll see it again. Forward rotation on the right side creates a compression and a restriction on the right side of that patient's airway. So this is one of the things that's been a huge game changer for my practice, is looking at the airway from both the front end that I can treat, the nasal aspect, which an ENT can treat, and then the neck or the cervical aspect that a proper neck doctor, atlas orthogonist, a NUCA chiropractor, there's so many upper cervical specialists that look at this and can actually help us get a better airway for our patients. All right, so we talked about proper breathing. And again, breathing is king, breathing is key. We've got to have people breathing right if we want them to be right and be healthy. We talked about the proper tongue position and function. So that's where I want to go now, is talking about how do we create adequate intraoral tongue space? How do we get the tongue doing what the tongue's supposed to do? And my best answer for that right now is myofunctional therapy. Basically, these are goals. You're working with like a personal trainer who's a key foundational doctor to help us get the tongue doing what it's supposed to do and position the way it's supposed to position. Patients are doing exercises about 3 times a day for 3 to 5 minutes to strengthen the lips, strengthen the tongue, strengthen the airway muscles, get them breathing right, get them swallowing right, get them doing their normal functions during the day to either help grow and develop the airway or help protect and keep the airway functioning in its best mode, and really help to keep the jaw from collapsing or relapsing in orthodontic issues. There's so many things that myofunctional therapy is doing for patients. It's usually a multi-phase program. We go through and assess how they're doing, what they need to improve on. We design a system, usually like a 12 to 18 week process, to go through and work on the areas that they're not doing well in. And then we grade them as they come in and out of that. And the research is showing that we can actually help sleep apnea. We can help snoring. We can make a big difference in patients' life just by getting them functioning correctly, using their tongue, using their proper airway, using their proper tongue position and functioning. One of the research studies that I posted here that came out of Stanford showed that myofunctional therapy alone could reduce the AHI, right, the apnea-hypopnea index, by over 50% in adults and 60% in children. So we know how important the function is besides just the form. If we can get good, proper function, we can get good breathing and we can get good sleeping. A lot of my patients, one of the things I'm doing now is I'm using a laser, an oral laser, where I'm going in and reducing the palatal tissue, shrinking down, activating the collagen and tightening up the airway tissues, the tonsils, the tongue, the uvula, the cheeks. There's so many things we can do where we can get patients from having like a Mallampati 4 to more of a Mallampati 3 or 2 or maybe even a 1. But again, reducing down that form so we can get better function. So sometimes we're trying to improve the form. Sometimes we're trying to reduce the blockages and shrink those things down. Great way to help our patients. So the next thing I want to talk about is proper jaw position, proper growth and development. This is again where I'm using my Vivos appliances many times to get wider and forward growth, get adequate airway volume in the joint space like we talked about, really create what we need for a really good health to succeed. So many times in the past, like I said, we've been using mandibular advancement devices to pull the jaw and then also the tongue forward, open the airway, create this better airway for the patient and support that airway throughout the night. And that's a great way to help a patient. But the reality is we can do better than that. And we can do better than that by expanding their palate, growing their jaw, growing their tongue space. The roof of the mouth is the floor of the tongue, floor of the nose, excuse me. So the roof of the mouth is for the tongue, but the floor of the nose is for the nasal breathing. And so we can increase and improve both of those aspects by getting some transpalatal expansion. You can do that surgically, you can do that non-surgically. In my practice, I choose to do non-surgical oral appliances that will actually grow and develop this maxilla, increase the volume of the nasopharynx. We start making more space for the tongue to properly position to the top of the mouth and forward, stay out of the airway, and also for the nasal passageway to stay open and the nasopharynx and oral pharynx to stay open for them to breathe and sleep better. And when we do this, we see that we can use some of these appliances to slowly expand and grow and widen and develop the airway and take them from a narrow jaw to a wider, broader jaw. So there's more room for the tongue to go up and forward versus down and back, which is where the air is supposed to go and flow. So better flow and better form allows better function, right? So we want to have our airway being the big blue where it's wider and bigger in the anterior and posterior dimension, and not this small, restricted, closed down airway that you see in the red here. So really the airway sleep and TMJ connection starts with proper breathing, nasal and unobstructed, parasympathetic, diaphragmatic. We've got to look at the breathing, because if you do everything else right, but you don't fix someone's breathing, they're going to always struggle. They're going to always clench and grind. They're always going to wear down and destroy their teeth and our teeth that we put in restorative dentistry. Proper tongue position and proper tongue function, it's huge. Start looking for tongue ties. Look for them in children especially. Look for big tonsils. Look for any sort of thing that's going to stop the tongue from going up and forward and keeping the airway open. Look for resistance, for restrictions. We need to get good, proper tongue function and proper tongue positioning to have a proper breathing airway. We want to make sure we get the jaws in the right place, get proper development of the jaws, make room for the tongue, which makes room for the airway, which makes room for the joints, makes room for the muscles to be elongated and down and forward, letting someone breathe and sleep better all night long. And then, like I did talk about, proper tooth position is key, right? But we've got to get all these other things done first so that we can retain that proper jaw position. Because if the tongue stays forward and resists all those forces coming in, you'll have a good airway. You'll have a good place for the tongue to stay forward out of the airway. And you'll keep the teeth from falling back and relapsing and collapsing. So you have to have a good terminal bite with proper jaw guidance. There are so many occlusal philosophies and therapies out there that I don't want to go into that today. I just think it's really important for every dentist to know we're in charge of occlusion. So make sure you have a good terminal contact bite where they come together in a balanced and unobstructed way. And that when they go to chew or when they go to speak or anytime they have to move their jaw, they have an easy pathway out. They don't have to hit teeth and don't have to wear teeth and don't have to destroy teeth to get in and out of that proper jaw position that hopefully has a proper airway function as well. All right. Well, I want to thank you guys all very much. This is always great to spend time with you, talk about something I'm very passionate about. Please contact me if there are any questions, but I hope that this practice inspiration today will help you look at airway a little differently and start looking for and even asking questions about airway in your practice, and make it a great day. And I'll look forward to seeing you next time.